welcome back to Chronic Care of Richmond. I'm Dr. Ben Hopsiker. We're very much looking forward to talking about the results of your first visit and how we can help you. We offer multiple options for treatment for our patients, and depending on your overall health, your diagnosis, the severity of your conditions, and other factors like your lifestyle habits, some of the services we offer may or may not be right for you. We will be making recommendations based on what we think we can do to promote the greatest possible outcome for your overall health without drugs and surgeries. Some of our treatments will be covered by insurance, but many will not. We will be discussing the details of the cost of your treatment specifically during this consultation. We want you to be able to make an informed decision, as your health is by far your most valuable asset. Our regenerative medicine procedure utilizes mesenchymal stem cells to promote tissue rebuilding and adaptation. These cells are present in all of us, in especially high concentrations in our youth. The primary duties of these specific cells is to control and organize tissue growth and regeneration. Part of the reason we have a tendency to wear and tear as we age is because our body does not produce these cells in the same intensity and quantity as we age. Our objective with this therapy is to create an environment to promote maximum rejuvenation to degenerated tissues. This recommendation is going to be most frequently made for those patients with significant degenerative arthritis. Platelet-rich plasma therapy, or PRP, is another option we have for regenerative medicine purposes. PRP utilizes your own red blood cells, your platelets, to promote and maximize your healing. Platelets are specialized red blood cells, and they are used to promote reduction of chronic inflammation, as well as to encourage tissue healing and rebuilding. They're especially valuable for promoting the rebuilding of damaged blood vessels associated with chronic inflammation. Very useful to encourage tissue to be able to heal and recover from chronic damage. PRP is also outstanding for concentrating the raw material necessary to promote healing and rebuilding, as platelets are basically floating bags of collagen, and collagen is the primary building block of most of our body's connective tissue. Chiropractic care is utilized where appropriate for helping to manage chronic pain. The focus of chiropractic is to increase your comfortable movement, promote better health for your joints and muscles, and increase your functional symmetry to reduce the sources of chronic pain. When combined with rehabilitative exercise, chiropractic is a phenomenal non-pharmaceutical approach to reducing chronic pain and improving quality of life. Trigger point injections are used to treat and manage the knots and hot spots that can appear in muscles associated with chronic pain. Trigger points are hyper-irritable bands of scar tissue and inflammatory chemistry that cause pain in the muscles and can lead to referring and radiating pain. Trigger point injections help to break that scar tissue up, allowing for easier movement in the muscles, allowing them to slide and glide rather than be stuck and produce additional pressure on the muscle. Non-surgical spinal decompression focuses on using mechanical traction to create increased joint space, reversing the pressure of gravity on the discs in your spine. In turn, this allows the discs that have been damaged, whether through acute trauma or repetitive strain, to rehydrate, increasing the overall health of the joint and allowing for significant reduction of pain. Class 4 laser therapy is used to promote tissue healing and reduce the negative impact of acute and chronic inflammation. In the same way that getting exposure to sunlight makes your skin darker and produce vitamin D, Class 4 laser therapy will be used to promote an increase in local blood flow, as well as increase energy production by the cells in the area, which then increases your body's capacity to heal and rebuild, as well as control the sources of chronic inflammation. We have two different electrical modalities available: interferential therapy and horizontal therapy. Interferential therapy is used to control active inflammation and swelling, stimulate blood flow, and immediately relieve pain. Horizontal therapy, utilizing the HACOMED system, is used to similarly help reduce chronic pain and inflammation, but will also promote tissue healing and regeneration through specific electrical stimulation. These can both be applied depending on your specific needs. Offloading bracing is an option for patients depending on the style and severity of degenerative changes found. By helping to shift the way the body distributes weight on the joint, offloading braces can help to reduce the amount of pressure applied to the joint, allowing for movement with significantly less pain, and when applied with strengthening and stretching exercises with our regenerative options, can greatly improve a patient's quality of life. Our approach is not about using pharmaceuticals to band-aid over or cover over your symptoms, nor are we going to be using surgeries that can have potentially catastrophic consequences to your health. Both of those types of intervention have their place in medicine, but our approach is instead not about covering symptoms, but encouraging your body to be able to heal and rebuild itself, addressing the underlying cause of your chronic pain and allowing you to achieve your ideal health goals. We will be with you shortly to review your examination and imaging findings, as well as to discuss your very specific care recommendations. We are excited to help you get your health and well-being back on track.